All right, welcome to the North Olympic Library System's Aging Well for February 2024. Grace Lambert is joining us today to discuss posture exercise therapy. Grace is a posture therapist who practices in Sequim. Her passion for posture therapy was sparked by her own journey with chronic pains, and I want to thank Grace for being here. Welcome, Grace, to the very first Aging Well. I am going to stop sharing my screen and turn everything on over to you.
Thank you, Corinna. Excuse me. It's nice to see everybody here. Wow, there's quite a crowd. So I'm looking forward to talking about my passion, which is posture therapy. And I have a slideshow that I will be going through. So I'll bring that up in a moment. And I just wanted everyone to know that I do have notes here that I'm going to have to refer to because the slideshow does have a lot of text on it. It has pictures. And then I have additional notes that just reminders for myself of the things that I want to cover. I will try to be concise. I could get really wordy about posture and really like to talk about it because it's just been my focus for so long now and it's changed my life so nicely. And at the end, I will, well, towards the end, I'm going to take us through some exercises so everyone can get a little feel for what it's like. And then at the very end, I will leave some room, hopefully, for questions and answers and my contact information. So let me try to get my screen slideshow up. Are you guys seeing that? Not yet, I don't think. I'm going to share my screen, that's why. Sorry. There it is. Okay, can you guys see that?
Looks good, Grace. Thanks.
Okay, great. Okay, so thanks again, Karina. It's really a pleasure to be here and have an opportunity to present to everybody here. So welcome, everybody. And now why is it, there it goes. Okay, so I'm going to talk a little bit about me and the injuries that I suffered that actually led me to posture therapy. I'm going to talk about what posture therapy is and is not in the reverse order there, and how it works based on what's called a functional design posture. I'll talk about the exercise, some of the exercises and routines and how they work, who posture therapy is for and who it's not for. There are some people that it probably is not appropriate for. It's actually appropriate for people with a lot of different conditions, diseases, limitations, or issues, surprisingly. So we'll talk about that too. In other words, posture therapy can help even if you have XYZ. We'll go over some of the exercises. There are 6 posture types that are defined by the institution that I work through, PTX Therapy. They have a program that helps me identify the posture deviations that people have and then choose appropriate exercises for them. There is a difference between posture therapy and other therapies, and I'll talk about that a little bit. And then I'm going to talk about forward head, posture, feet, and a few more things, and then we'll have questions and answers. So I'm 70 years old. I've lived here for over 20 years with my husband, Steve. Been married for over 30 years. And he, by the way, has exercised every morning for years to stay pain-free and active. And that came about because he had a back issue, and now he doesn't have a back issue. So we worked in technology for a long time. I should be much more familiar with all this than I am now. But since moving into posture therapy, I've just gotten way out of touch with technology. I was certified as a personal trainer. I did corrective exercise therapy. I was a senior fitness specialist all through the National Academy of Sports Medicine. I'm certified through the Egoscue Institute as a posture alignment specialist, level 2, and I'm a PTX licensed therapist. I own Posture First Exercise Therapy and co-own Northwest Fitness and Wellness Center, which is a new center that's opened in downtown Sequim. And my co-owner is Kevin Pedry. You might know him from the Sequim Gym. He owned the Sequim Gym a number of years ago, and that's how I met him. I worked with him at the Sequim Gym. I teach classes, I give workshops, I offer private posture therapy sessions, and I absolutely love my work as a posture therapist. So I'm going to talk a little bit about what I did, which led to a lot of my injuries. I was crazy as a young person. I skateboarded, I broke my arm. I dove into a lake, dislocated my shoulder. I skied, I dislocated my shoulders. I rock climbed, I dislocated my shoulders. I ice climbed, I dislocated my shoulder. And then I did mountain climbing and slid down the mountain like this woman is demonstrating, head first on my back to demonstrate how to self-arrest. At the time I was co-teaching a class, and I went over a rock and split my back wide open. And fortunately, the people there were able to handle that. It wasn't a serious injury other than, I had to get butterfly clothes. So, but I broke bones, neck sprains. Obviously, I said I dislocated my shoulder 12 times before I even went to a doctor. I had surgery and went through physical therapy, and I dislocated my left shoulder a number of times and had surgery on that as well. So lots of surgeries. All these injuries led to pain, and so I had chronic pain, and I sought all kinds of treatment. I went to an acupuncturist many times. I went to chiropractic for 14 years. I had cortisone injections, did massage therapy and foam rolling and all kinds of things. So all of those things helped me temporarily, but not permanently. That's the only picture of me in the slideshow. That's my horse Magnum. It was my husband's horse and then became my horse. And I did all kinds of things with horses, including riding my bike and leading them. And I worked with horses that I really didn't have any business working with, like a racehorse off the track. And he kicked me in the face, in the jaw, exactly as this horse is shown kicking the other horse. So the tail end of that one leg met my chin, splintered a bunch of teeth, and broke the condyles in my jaw. And I had to be wired shut for 6 or 8 weeks. So then I got a diagnosis that was really unwelcome. They said I had severe osteoporosis, and that really freaked me out. And I decided, well, I could continue sitting at a computer all day, which is what I did, other than the weekend warrior type things that I was doing with horses, or I could become a personal trainer. And that was a pretty easy decision because I knew that if I became a personal trainer, it would keep me active. And I ended up loving being more active and helping others. So after I became a trainer, then I expanded my skills to include the corrective exercise and the senior fitness training. And that's largely because I live in Sequim and there are a lot of seniors, and I wanted to work the community here. So Barb Pascal was actually one of the people that got me interested in moving into personal training. I had worked out with her at Anytime Fitness, and you probably all know her from her work as a retired physical therapist giving lectures at Shipley Center and for working on wellness and stuff. Wonderful gal. So at that time, I named my business Flamingo Fitness because I liked the idea of all of us trying to balance on one leg because we were wanting to work on balance. So I thought that was cute. And I really loved the women I worked with. I had a small studio behind my house that my husband had put together. And we had a great time. But one of the things I noticed is that they all still had pain, and so did I, despite the corrective exercises that I was giving people. So that was kind of baffling. And and I didn't really understand it. I actually went back to Peak Performance Therapy for therapy on one of my shoulders. And he asked me to, Aaron, who was the owner at the time, asked me to work there part-time, well, actually full-time, while one of his aides was off on maternity leave. So I did that. I loved that. And one of the patients that I was working with asked me if I had ever read this book, Pain Free, A Revolutionary Method for Stopping Pain by Pete Egoscue. I said no, and she brought it in and loaned it to me. I read it in one weekend and I thought, this is what I want to do. This is what I've been looking for. I was super excited by what was shared in that book. It was stuff that I had never, in all my time as a personal trainer or in physical therapy, I had never heard about the effects of posture on our body and how it can cause pain. And by becoming better aligned, it can help eliminate pain. So I quickly read all of the rest of Pete's books. And I feel like reading those books were some of the best decisions I had ever made, including marrying Steve, and then contacting a posture therapist and doing the exercises he gave me. Now that's important. I'll talk about that later. And then becoming a posture therapist myself and opening Posture First exercise therapy here in Sequim. And then another great decision I made was going into business with Kevin and opening Northwest Fitness and Wellness. So the posture therapist I connected with was Matt Whitehead, and he's the owner of Oregon Exercise Therapy in Portland. And I connected with him because I looked online for a posture therapist near me, and I read the websites, and his was the most intriguing, most informative, and just really drew me to him. So I contacted him and had a private session. Well, I had a free evaluation, which I was really impressed with. And then I signed up for one private session, and after that I was hooked, and I had 16 sessions with him. And from then on, I have sessions with him when I need it, or he's a great mentor to me, and I meet with him pretty regularly to talk about more challenging clients. And it's just been great. And I do posture therapy every day, as does he, myself. And so it's awesome. So I'm going to talk about what therapy is not, because there's fewer things about it there. It's not a medical procedure or process. It has nothing to do with the medical industry. It's not a fitness routine. It's not really a fad. We don't use any gimmicks or braces to try to hold the body in position. You see online, wear this brace to hold your shoulders in position, or back braces to help with back pain or back issues. But those things don't really take into account that your muscles are what's supposed to hold you in position. So we don't use any of that stuff. It is not incompatible with most other types of therapy or treatment, or even any kind of other training you might be taking, whether it's kettlebell training or resistance band training or swimming or yoga. It's not a quick fix for pain or any other physical issue. And contrary to the sort of the impression people might get when they think about the book, the title is Pain Free. You don't become pain-free and stay pain-free unless you continue to do the work. So it's not covered by insurance because Pete Egoscue did not want to buy into the insurance industry, which then limits what people can do. So people have to pay for this therapy, but by paying for it, like you pay for a car repair in some ways, you have the tools for the rest of your life to help keep yourself out of pain. So even though people might say, wow, that's expensive, it's really not expensive because I don't have to see a chiropractor hardly ever anymore. If I really need one for an adjustment, I see one here locally. I love him, but I should say them. And I don't need acupuncture. I mean, I love getting some of these things, like especially massage. I've gone to a local Rolfer and really appreciated it, but I keep myself out of pain and moving and active. And so posture therapy is really essentially all I need. So what is posture therapy? It's really uncomplicated. The choosing the exercises is not uncomplicated, but it's an uncomplicated method. The idea of it can best be described as, bones do what muscles tell them to do, and form follows function. And if you look at these two pictures, who looks the most functional? Who looks the happiest? Who looks like they feel the best? And each of these pictures is showing function. The kids on the left I guess it's on the left for you, I'm not sure, are running around, using their bodies, exercising, they're functioning, their body is going to function better than the person on the right who's slouched in poor form. And if they stay that way for very long or often, their form is going to follow that function. Okay, and then bones do what muscles tell them to do. This, essentially means that your skeleton doesn't move all on its own. The muscles have to move them. And so by creating muscles that work better, the skeleton can be aligned better. So I'll elaborate on that a little bit. So posture therapy looks at the whole body. So when I look at a person, usually in shorts and a t-shirt so they can see their joints, I'm looking at the whole body and trying to see what's in alignment and what's out of alignment. And then based on what I see, I try to pick exercises that are going to restore proper muscle recruitment and functional movement in that person based on whether they have rotation or how their pelvis is tilted or something like that. When they can move more functionally, it's going to help restore the joint alignment in their bodies so they're more properly aligned. And when they consistently move functionally, it helps keep their body in alignment. Then this results in less wear and tear on the joints, and that's pretty obvious if you think about how, for example, a person who has a knee valgus, where one knee is not lined up with, like the other knee is straight and the one knee is bent like this, there's really a lot of wear and tear on that knee joint. Whereas if it was more aligned, you'd have less wear and tear. The joints are meant to be lined up a certain way. When joints are in better alignment, pain and movement limitations are reduced and sometimes even eliminated. In my case, largely eliminated. Surprisingly, well, maybe not so surprisingly, the functions of the respiratory and cardiovascular systems and the digestion improve when we're better aligned. And you can really kind of understand when you think about forward head posture and forward flexion in the thoracic area. It's reducing your lung volume. It's contracting making your diaphragm less able to work, and all of the organs in your digestive area are compressed. And so when you straighten up and get more aligned, all of those functions work better. And like I said, it's based on a premise that there is an ideal functional design. And this was created by Pete Egoscue, and he defines it as 8 load-bearing joints. So these are the ankles, the knees, the hips, and the shoulders. And when they are not in vertical and horizontal alignment, they suffer wear and tear that they would not suffer were they in alignment. So if one or more is out of alignment, say your knee is valgus, then some other joint has to compensate for that. And so pretty soon, other joints are out of alignment, and the spine and the SI joint is probably going to come out of alignment as well. So it kind of ripples down into different areas of your body. Posture therapy exercises are designed to teach the muscles to work properly, and that helps to bring the joints that they are attached to back into better alignment. It uses exercises from a lot of different disciplines: yoga, Pilates, strength and resistance training. We even have some weight training exercises once people are fully functional. There are some exercises that have been developed that are unique to posture therapy, although it's been around long enough that I think other modalities have probably started incorporating those into their practices. when any of us posture therapists see clients privately as opposed to teaching classes, the routines that we create for them are customized to correct their posture deviations. So if someone comes in and they have a certain posture like forward flexion and a tucked pelvis, and we'll see pictures of that, they're going to get different routine than somebody who comes in who has really excessive lordosis. Their low back is really arched and their pelvis is tilted forward. The two are not going to get the same kind of exercises. So the exercises are really somewhat simple. They're often quite gentle. Some of them, when I first introduce them, people think, why didn't I know about this to relieve my back pain? It's just laying on the floor in a certain position. Oh my gosh. So super gentle. Then others are a little bit challenging. But they're designed to target specific muscles or muscle groups and to take advantage of gravity, which is a force that's pulling on us all the time. Clients, whether they're in a class, we teach small classes here, whether in a class or private sessions, are taught to do the exercises in good form so that they're not using muscles that are not really needed in the exercise. So instead of compensating for dysfunctional muscles, we're trying to get those dysfunctional muscles to work correctly so they become functional. So like I said a little earlier, people who learn these exercises and get these routines, they have a toolbox for the rest of their lives and they can help themselves get out of pain. You can wake up in the morning and see how you feel, and do you feel okay? How's it going? What do I need? It's just works really well for that. And the exercises do require some equipment, but it's minimal, and a lot of the stuff that the equipment could actually be, you could substitute an ottoman or a couch cushion or a rolled up bath towel. So none of the exercise equipment is really required. For example, a roll, oh, you can't see me, I guess, so sorry. I'll show you later. Okay, so just a quick summary. Muscles that function correctly, move the joints back into better alignment, and they're better able to keep them in alignment when the exercises are done. Regularly performing the exercises results in increased flexibility and strength, better joint alignment, improved balance, and the ability to move more with less discomfort or pain. And that's really important because when you hurt, you don't want to move. And when you don't hurt, you are willing and usually excited to do some movement, whether it's just going for a walk with your dog or moving around the kitchen, cleaning your house, whatever. Posture therapy is basically for people of all ages and abilities. Young children don't usually need it, although occasionally they come in with issues. And seniors in their 90s and even up into 100. My dad was 100 when I started posture therapy, with 101. Recreational and professional athletes can improve their performance with exercises like this. There are a number of teams like the 49ers who do posture therapy regularly to keep their players going. People who have been active in the past but are no longer able to be due to pain and limitations can benefit from posture therapy. Even sedentary people who have not usually exercised at all can benefit. And anyone who's been released from physical therapy or rehab after injury or surgery. I don't take people who've had surgery but have not gone through rehab unless their doctor says, okay, you can go do this. And again, people who've been sedentary or disabled, and I'll talk a little bit, if I remember, about disability, because I have a colleague who was disabled in a wheelchair and is now dancing and teaching posture therapy. So, why did that? There we go. Hang on. So posture therapy is not for anyone who's not able to do the work or willing to do the exercises. I mean, if they change their mind and become willing to do them, then I can try to help them. But if they're unable for some physical reason, then it wouldn't be for them. Mindset is pretty important. So anyone who has a firmly held belief that their body is broken and needs fixing, and they can't let that belief go or even set it aside, that is going to interfere with their progress. And so they really have to kind of start to shift their thinking into saying, well, okay, I've been disabled for a long time, but maybe I can do this. So that's just something to think about. And again, I said a patient who's just out of surgery has not been through therapy or release for exercises, I would not work with them. There are physical therapists who do posture therapy, and they would be able to work with those people. And then anyone with a really serious health issue who has not been cleared by their doctor to exercise would not be appropriate for me to work with. Posture therapy can help if you have arthritis pretty much of any of your joints, including all the load-bearing joints, even your hands, although there's nothing specific to posture therapy for the hands. Issues of the spine, degenerative disc disease, bulging or herniated disc, kyphosis, which is forward flexion, stenosis, which is a narrowing of the spinal canal area, scoliosis, which is a lateral curve of the spine, and spondylolisthesis, which is where one disc slips forward of another, and retrolisthesis, where one disc slips back. It can help if you've had physical therapy for shoulder dislocations, frozen shoulder, surgery for rotator cuff tears or other repairs, and also hip issues. I didn't list that there, but lots of hip issues. And if you've had joint replacement surgery, it's totally appropriate. People who have foot issues, plantar fasciitis, Achilles tendonitis, neuromas, hammer toes, and other foot problems can benefit from posture therapy. TMJ, migraines, neck pain, and things that have to do with the head and neck. And I realize that I'm gesturing with my hands and nobody's seeing it, but that's how it goes. So posture therapy can help even if you've had limitations due to previous injuries, joint replacement, like I said, or loss of limb. This woman here is Bethany Hamilton. She's a pro surfer. She lost her left arm when a shark bit it off in a surfing accident. And posture therapy keeps her balanced and moving and still surfing professionally with one arm. Doesn't matter if you're skinny, overweight, or a perceived perfect weight, it will work. And it works even if you don't like exercise, but you actually have to do the exercise. So that's something to remember. It can help even if you've been misaligned for years. These are not my clients personally. They're clients that were part of the Egoscue training. The woman on the left, you can see her posture has improved. The man on the right, his posture improved. And the woman in the middle is a woman that worked in fields and was bent over a lot, all day, every day. And Pete worked with her, and he put her in what we call the tower. And this is what she came out looking like after 2.5 hours with him. Now, she wasn't going to hold that posture for good. She had to do these exercises, but it goes to show how quickly a change can come about. It doesn't always come about this quickly, but the tower is a really powerful exercise tool. So I'd like everyone to stand up, and I'm going to, so I think I'll stop sharing and just ask everyone to stand up, and we're going to do some exercises here, okay? And I'll demonstrate and just describe what you need to do. So the first thing you're going to do is just stand and close your eyes and get a feel for where your weight is. And are you swaying a little bit? Don't try to change anything. Just take note of how you feel. If your weight is swaying back and forth, if your weight is heavier on one foot than the other, or perhaps heavier on one part of one foot. You're just taking notice of that, okay? And then you're going to go ahead and open your eyes and put your feet about hip width apart. And hip width is a little narrower than most of us think. Our hips are, if you can still see me, our hips are in here, not out here. Okay, this is our hips. So a fist and a half, 2 fists at the most width apart. And then you're going to retract your shoulder blades so that you're standing up as straight as you can. And you're going to lift your shoulders up and then lower them back down. And lift them up and lower them back down. And when you lower them, I want you to lower them a little bit lower than they want to normally rest. So we're engaging the muscles that pull our shoulders up, and we're letting them stretch out as we lower them. We're going to do this about 10 times. So we're just reminding the shoulders that they can elevate the scapula. The scapula can elevate and they can depress, okay? And now we're going to start that move, and then we're going to roll them in a circle forward 10 times. So we're elevating them, we're rotating them forward, we're squeezing them together behind and bringing them back up 10 times in a big circle. Nice and slow. If you have snap, crackle, and pop and it doesn't hurt, you're okay. If you have pain, you don't want to be doing this. You could contact me later. And then we're going to go backwards. So you're doing the same thing. Lift up, retract your shoulder blades, lower them down, bring them forward, bring them up, retract them in a circle backwards 10 times. So we're just reminding the shoulders and the scapula that they can move like this. Okay, you can shake that out a little bit. So keep your feet hip width apart. Retract your shoulder blades again. Bring your arms up out to the side. And you can either put your hands like this or like this, but your arms and your hands are straight. Okay? And if your arms hurt to hold them up this high, you can lower them. You're going to rotate your arms forward in a circle about the size of a dinner plate. And your body will sway a little bit. That's fine. You don't have to keep it from swaying. You want to rotate them. Let's go about 30 times. You might get a little tired doing that. And the size of a dinner plate is 8 to 10 inches. So you're going to feel a little fatigue in the deltoid muscles. And then you can lower your arms and shake that out. And then we'll do the same thing. If you have shoulder pain, be careful, okay? Just lower the arms or don't just skip this. You're going to do the same thing. Your arms are going to go out, but you're going to rotate your palms facing up as far as you can face them up, and then rotate your arms backwards in a circle. The same amount of times, about the same size of the dinner plate. Go 20 or 30 times. Now, I have had people who come in here in my studio and they can't do this at all when we start. By the time we're done with our sessions, they can do this just fine. And then shake it off. Okay, we're going to do one more exercise. Actually, 2 more. I want you to take your toes and point them out so now your feet are pointed 45 degrees like this. And you're standing up straight. And all you're going to do now is squeeze your glute muscles together and release. Squeeze and release. Squeeze and release. So you can put your hands on your buttocks if you want, or you can just let your hands rest to the side. Just let your hands hang to the side. So what we're doing is squeezing those butt muscles. Squeeze them 20 times. And that you might feel, most people do, the 2 sides are going to feel different. One side feels looser, the other side feels tighter and more contracted. And try to relax the rest of your body. Try to let your abdomen be relaxed and your inner thighs be relaxed, and you're just squeezing the butt muscles. Gluteus. Now put your feet pointed straight ahead. butt hip width apart, and squeeze your butt muscles again, 20 times. You want to be standing up as straight as you can with your shoulder blades slightly retracted. And again, you can touch your buttocks if you need to or want to. We're trying to isolate these muscles and get them to work on their own. And I think I'm going to end it there because it looks like people might not have the right environment to do what I'm asking for the next one. So we're just going to skip it. Now I want you to close your eyes again and just get a feel for whether your weight feels a little more solid on your feet. If you feel like you're not swaying as much as you were when we got started. Usually people feel a subtle change in how they are connecting to the ground during those. Okay, so I'll go ahead and share my screen again and go back into the slideshow. Are you seeing that if I go there? No, okay, hang on. There, did that work? Okay, great, thank you. Okay, so I wrote all the instructions that we just went through down. So now I will click through those. These are what we did: shoulder shrugs, shoulder rolls, arm circles, and this is what the arm circles looks like. And then we didn't do that one, so we did this one. Okay, and so we'll talk about this a little bit at the end too. So I'm just going to share some images of some of the exercises, and I'm going to quickly look at my notes to make sure I cover some of these things here. So yeah, each of these exercises can address a variety of issues that people have, and there are over 800 exercises in the PTX therapy database. So for example, the abduction-adduction exercise, if somebody has a little bit of hip discomfort, maybe stiffness, and they don't have severe arthritis, this can be used to introduce motion to the hips and make them feel like they're getting lubricated in a really nice way. And also if people have a stiff low back or a pelvis that feels kind of locked up, this move can help gently. So you're moving your knees in, it's shifting your pelvic position a little bit. You move them out, it shifts it the other way a little bit. And that then gently shifts your lumbar spine a little bit. So this just simple move can work on moving the hips, can work on I should say the femurs in the hip socket and the pelvic position and the lumbar spine. It's very gentle. And then moving to the assisted hip lift, that's a bigger stretch and can be really beneficial. Static back is one of the favorite exercises of almost everyone because they can lay there on the ground or on a pad with their legs up like this and just let gravity gently relax all their muscles. And that really helps realign their spine and their hips, their pelvic position. Towel settle is also a nice one for people. And then cats and dogs, that gets people flexing their spine forward and putting it into extension. Then we start working with abs. Now these are just a random sampling of exercises, okay? I'm not choosing them for any particular order. Wall stork and stork walk can both really start to challenge the hip stabilizer muscles. And those can be, especially if people have hip pain or various hip problems, they can really start to be tight and weak and painful. And by doing certain exercises to help relieve that pain and get them moving again better, then this kind of exercise can help strengthen those muscles that have been tight and weak and make them more supple and stronger. And then the child's pose, as opposed to the typical child's pose, which puts your spine in full flexion. This puts your spine into relative extension, so you can see that it's flatter and not rounded. We spend already far too much time in a rounded position. So, okay, and then these supine groin exercises are remarkable. That I referred to the tower earlier, and this is PTX version of the tower. So this exercise can be just life-changing in helping to realign all those 8 load-bearing joints, the ankle, knee, hip, and shoulder, and also reorient the spine and the pelvis into what we call neutral. And there are lots of variations of this exercise. And then knee pillow squeezes is focusing on the inner thigh muscles, which help to control the position of the pelvis. And the abductor presses focus on the outer thigh muscles and the glutes, and that also helps control the position of the pelvis. And then double combines the two, so you're simultaneously working on all those muscles. It's a very challenging exercise, but remarkable in how it makes you feel when you're finished with it. So PTX therapy identifies 6 posture types. We're not going to go into much detail about these. I just listed the types and what we're looking for. And then this helps influence me and the posture therapy program in what exercises to give a client. So anterior pelvic tilt, we usually see this in people who have been athletic or are still athletic. They're pretty tight. And the anterior means that the pelvis is tilted forward. I don't know if you'll be able to see my little mouse here. So you can see the pelvis is tilted forward. There's lordosis in the back and flexion in the spine and a forward head. And the feet are usually kind of external. And then posterior, this is the pelvis is tilted posterior, it's back. So the front of the pelvis is a little bit higher than the back of the pelvis. And this usually results in a flat back. You can also see kyphosis. Forward head is very common, and almost always you see bent knees in this position. They can't straighten their knees very well. And then rotation. So the rotation can be in the hips or the shoulders or both, and that's going to influence every joint in the body. You can kind of see how this guy is rotated, and so none of the joints are really perfectly aligned there. And then these are slight variations on these two are slight variations on 1 and 2 as well. So this also is usually a posterior pelvic tilt, but the person is usually looking down. There's like a forward lean in their posture here. And then we call this sway back. So the hips are forward of the knees and the ankles. And so you have we might have the shoulders and ankles in alignment, oops, but the hips are forward. This causes usually a lot of low back pain and issues. And then 6 is a lateral curve. So you either get spinal scoliosis or a lateral offset. And so that's a tricky one. So posture therapy looks at the whole body. No part operates in isolation. And the exercises I said are customized for each client's posture deviations. This is the only picture you'll see of one of my clients. And this is what she looked like when she came in. This is only one of the exercises that I gave her, and you saw that earlier in child's pose. This is actually a different name, a different exercise. And then she was able to hold her head up. Now, this is not after the first session, but she got better and better. And people noticed, she felt better. She was able to do more. She'd go out to lunch with her friends. And it was awesome. She developed a health issue that made it so she couldn't continue. And so she's regressed. Most other physical therapies look at one body part, and that's because a physician prescribes therapy for that particular part. And a physical therapist is not allowed to treat another part of the body that's not in that prescription. They have to answer to the physician, and they have to answer to the insurance industry, Medicare or whoever you have insurance with. So if a patient comes to a doctor with pain in one knee, the doctor usually orders physical therapy first. But let's just say in this case, he's ordered an X-ray of the knee, or maybe both knees to make a comparison. But usually they don't order X-rays on both knees unless the patient is complaining about both knees. So if this patient, the X-ray reveals arthritis or some problem, the doctor's going to order physical therapy on that problematic knee. And the arthritis is said to be normal and expected because of the age of the client. But a posture therapist always says, why did only one knee develop arthritis? Both knees are the same age. Now, if there was a traumatic injury to a person in their youth, or they had some other issue, that's one thing. But normal wear and tear, if one knee is worn out, why isn't the other knee worn out? And it's usually because there's been misalignment, and that one knee is more misaligned than the other. It can be due to the opposite hip having problems, and so the person favors that hip, and so the right leg works harder, and the right knee has taken the brunt of that because it's between the hips. It's sort of stuck between the hip and the ankle of that leg. So you never know what might have caused it, but arthritis is not generally just, we don't think, a normal part of aging. It doesn't have to be. People who stay active and are in better alignment do not have arthritis in the same way. And of course, rheumatoid arthritis is different. We're talking about osteoarthritis. So a posture therapist looks at that whole body to try to find the imbalance that might have explained why that one knee developed arthritis. And this is where we do functional tests and try to figure out, okay, how are the hips working? How are the ankles working? What might be going on? Is there a shoulder issue that's making them carry themselves a little twisted and there's a lot of torque on one knee? So that's just how it looks. So as a client of a posture therapist and the posture therapist, we basically are playing detective. Sherlock Holmes and his trusty sidekick, I forget his name. And we rely on the clients to really help us figure out what's going on. They're the experts over their own bodies. They come in and tell us where they hurt. They tell us why they think they hurt and why they think that when the pain might have started. We listen to all that and we trust what they're telling us to help us figure things out. They can tell us what feels good or right and what hurts and why they avoid certain moves. So if something feels good, we cue into that. Okay, it feels good to lie on their back. So, okay, we can lay them on their back to do certain exercises. It doesn't feel good to sit, so we will avoid sitting in the beginning of the program. So we build exercise routines that help address the issues that we see and we know are going to help correct those issues, all the time relying on the client's feedback about how the exercises make them feel while they're doing it and during the week or weeks between sessions. And so it's a constant interaction all the way through the therapy. But in the end, and this is really important, that's why I have it italicized in bold, it's the client's dedication to the program that elicits the changes in their bodies that we seek. If they don't do their exercises, they're not going to have the changes. And that should be obvious. And we understand getting busy, getting sick, having issues, totally understandable. But we are here to motivate, inspire, and encourage people to do their exercises every day. I actually text my clients sometimes, hey, how's it going? And I might email and say, don't forget to do your exercises tomorrow morning. And they love it because it really does help them. So we're going to quickly look at head posture. I think we have enough time to do that and answer questions. So forward head posture is usually the result of the position of the upper back. And that's when it gets into forward flexion. And also people who might tend to get a forward lean in their body, they might look down. Anyone who's using a cane or a walker, especially if the walker's not properly adjusted, is going to be hunched over and looking down. And a lot of people blame this on age, but honestly, if people stay active, and I'm talking about like walking, looking where you're going with your head up and swinging your arms and doing the simple things that swimming, using your arms, reaching up for things, and not sitting around in an easy chair watching TV. Here I am demonstrating with my body, and you're not seeing it. I'm sorry, but slouching in your easy chair, knitting all the time, or reading all the time, or weaving, and not getting up and taking breaks and doing things to counteract the effects of being in forward head posture. The problem is getting really prevalent in young people, and it's disheartening to me. It's very sad when I see young people now walking around or standing at the corner waiting to cross the street, and they're bent over their cell phones because they're not doing themselves a favor. They call it text neck. So the neck muscles are extraordinary. They're layered in a beautiful pattern that allows them to move the head and neck in certain ways and not interfere with each other. And of course, that's true for the whole body, but I just am so fascinated by the neck. I recently was at an online dissection of the neck, and those muscles are very thin, and not very long, as long as our neck, basically. And it's remarkable what they can accomplish. They allow us to rotate our head from side to side, to lower the chin and bend the head forward, yes, and to lift the chin and look up and tilt the head to side. So you're putting your ear towards your shoulder in one way and the other. And they also assist with chewing, swallowing, and breathing. But they're not meant to hold our head forward. And this is what happens to a head that gets more and more forward. It starts to weigh, relatively speaking, to our muscles more. It gets heavier and heavier. And so that's a lot of weight for your little neck muscles all the way down into your upper back to try to hold up. So imagine a normal, let's say a 10 or 12 pound bowling ball on the top of your spine, and you're straight up and balanced, and your head doesn't weigh that much. It's just fine. And every degree it goes forward, it weighs more, relatively speaking. And so just imagine a 60-pound bowling ball now. It's awful. It's very painful. So the exercises can help reposition the entire body so that the load-bearing joints in the spine are in better alignment. And by reducing forward flexion of the upper back, that neck and head can actually come back into better vertical alignment. Now, if someone has really serious arthritic changes in their neck, this might not happen, but still doing the exercises can help them feel better. Strengthening all those muscles that help bring their thoracic back into more extension can help them feel better, even if their neck still has some arthritis. Like I said, there are a lot of exercises, and so there are a lot of exercises that can help this. But nothing operates in isolation, and so the pelvic position and the thoracic back are so tied together that one always influences the other. And so sometimes just changing the pelvic position to be willing to bear more load allows the thoracic back to go into better extension and hold itself more upright. And sometimes it's the other way around. The thoracic back has to get changed a little bit first, and then the hips are more willing to come back underneath and hold the body. So we're going to talk about feet just for a few moments. And I really think that these pictures, I almost don't have to say anything. But the picture on the left is a baby's feet. And that's what they look like when they're born. They're V-shaped, and they would stay that way if they were never shod, or if they were put in shoes that allowed them to maintain that shape. But the fashion industry for decades, probably hundreds of years by now, because if you go back and look, there were people in medieval times that wore these very narrow, pointy shoes. People wore high heels. So people have been crippling themselves with shoes for centuries. And we cripple horses with shoes because they're not meant to be shod. So this is just showing you now bunions are, they're just one foot problem. And high heels and pointy shoes really encouraged bunions. But that's not the only reason people get bunions. There are other reasons. But by keeping the feet barefoot or at least minimally shod and using toe spacers if necessary, we can really help people who have foot problems. And you can see how this tree climber, how agile and useful feet can be. And then there's two other people here who have remarkably functional feet. This is Jessica Cox. She's an accomplished pilot and motivational speaker. She was born without arms, and she is amazing. My father introduced me to her years ago because he was a pilot, and he met her when she was in her 20s, and he was so impressed. She flies an airplane. She talks on the walkie-talkie thing to the tower. She uses all she uses is her feet because that's all she has. And then Felix he plays a French horn. He sits in a chair with a horn supported by a stand, and then his toes do all that fingering to play the instrument, and he does a great job. So is it ever too late to do posture therapy or to get in better alignment or get yourself out of pain? I could honestly say I don't really know. Maybe it is. But my parents were active most of their lives, really quite active. My mother played competitive tennis until she was 75, and then she broke her ankle severely and stopped playing tennis. Then she took up golf, and my dad golfed and flew airplanes, and he jumped off of Tiger Mountain in a paraglider when he was 84. So they were quite active. But then they both got ill. My mom had a stroke, and when I went to take care of her and then she died, my dad was largely bedridden. He could totter to the bathroom with a walker, but he didn't have the strength or energy to get up and move around much. And so I did posture therapy exercises with him in his bed 3 times a day. He was lucky to have someone, do that for him. And he was happy to do it. And then within 2 months, sooner than that, I got him into a chair doing exercises, and then I got him standing doing exercises. And in 2 months, he was walking, and he actually was able to walk unaided, but my husband and I were pretty cautious about that. So if he was unaided, one would be in front and one behind. But he used a wheelchair or a walker and a cane, but he could make his way from his bedroom all the way into the kitchen, and he was thrilled. So for 2 years, he was able to walk around, and then his health, he had a carotid artery that was blocked, and he just didn't have the strength and energy to do much of anything after that. So, but it was wonderful to be able to give him that. So I want this presentation to inspire and encourage you to move more, no matter what you choose to do. Posture therapy is great, but if you get straighter by moving more and increase your flexibility by moving more and become stronger by moving more, you will sleep better, and you will sleep better because you've been moving more, and you'll feel better because you've been moving more. And I use this phrase on my own, but Katie Bowman has been using it for years, and probably I heard it from her first. So she has some great books, Move Your DNA, a whole lot of books, so I won't mention them all. So if anybody wants some resources, they're listed here. And I believe this talk is going to be on YouTube, posted somewhere, and Karina can talk about that. So you'll be able to read these later. I have written a book. During COVID, I didn't see clients in person. And so I interviewed a bunch of my colleagues who got into posture therapy because they were looking for pain relief, and it got them out of pain and moving again. And the one I mentioned earlier is named Nicole. And she was in a wheelchair. She couldn't even hold a piece of paper between two fingers. And posture therapy got her out of pain. She's a dancer. She returned to dancing and teaches posture therapy now. And my colleagues have some pretty interesting stories. My story is in there as well. And one of my colleagues, Cynthia, who is going to help me give a talk on foot function at the end of this month. And then, of course, Pete's books. I recommend for sure Pain-Free and Pain-Free Living. The others are also good. Katie Bowman's, I really love Alignment Matters. It's a compilation of her blog posts. It's quite a tome, but it's, big book, but it's great. And she's so entertaining in her writing and how she gives talks. And then Move Your DNA is kind of revealing, good book. Then my website is listed. You can schedule a free assessment there. You can send me email. I'll go to the next page in a moment. The Northwest Fitness and Wellness Center is listed there. My mentor's website is listed there. He's got a lot of educational articles on his website that might be interesting for you to read. And then PTX Therapy is the software that I use to create routines. So I'll go back there for a moment. PTX Therapy is actually available if you wanted to subscribe yourself and use their tools to figure out what your posture deviations are. It will create a routine for you, and then you can go through the process and you answer a questionnaire every week. You do the exercises, and you build your own routines through that method. Some people like to do that. I've had people who read my books and then choose to do that. But some people, and largely in this community, I'm finding a lot of people prefer personal sessions, and that's what I prefer as well. So thanks again to Karina and Knowles for hosting this. Thanks to all of you who attended. Thanks to my clients who do the work to help themselves feel better, and thanks to my colleagues for their unwavering enthusiasm for this work and their support of me and each other throughout all this process. So thank you. So if anyone has any questions, I have a little time. Is that okay, Karina?
Absolutely. We've got, what do we have? About 18 more minutes we can use. There is one question in the chat, Grace,
Okay.
asking for clarification. Is PTX therapy another name for Pete Egoscue's work, or is that a different thing?
So Pete Egoscue, his work is called the Egoscue method, and he created a software program called ePete. PTX therapy was created by a man who owned an Egoscue clinic for many years and branched off onto his own. And one of his clients, who was a professional football player, I believe, funded the development of PTX therapy, which is also a software program. And I prefer that to ePete for the visuals and some of the other tools that they go. So a lot of us are PTX licensed therapists now and use that software. Any other questions? D&D? Hi.
Hi. I've done work with a pedagogic therapist many years ago, so I'm familiar with the work, and actually have 21 little programs that I collected over time. I'm wondering, my question though is about, have you cross-pollinated much with Katie Bowman and her nutritious movement?
No. Not at all, because her program stands alone quite well. I actually, to be honest, I wanted to, between the time of becoming a personal trainer and finding this work, I wanted to take Katie's program and become a trainer, but she had closed it by the time I got around to doing that. And so I got into posture therapy instead. I actually don't know Katie personally. I've met her at a talk briefly. She's busy and travels, and I'm busy, and so it's just the way it goes. But she has a lot of stuff on her website, Nutritious Movement, and it
Sure.
stands by.
And the other question I had is, I'm assuming that a lot of people have come to you because of back pain, which is like endemic or in our society. And have you, and I'm wondering, are you familiar with Stuart McGill's work out of Ontario and his big 3 exercises and how that may or may not fit into the work that you do?
I'm a little bit familiar with it, but not enough to comment other than that I know that it's not incorporated into posture therapy. That doesn't mean that some of the exercises we do don't do the same thing, but yeah. Where'd you go? Oh, there you are.
Thank you.
Yeah, and you should know that I do have a number of clients who did Igasu in the past, like you, and have found out about me and came to me. So yeah, and I'm gonna ask you quickly: do you still do your exercises? Do they help you?
Um, let's see, I'll make it real short. I found out that I did it for religiously every day for 3 years, and I still kept getting serious back pain, and what it turned out, I went to an active release therapist who identified frozen fascia in various parts of my body that was keeping my
Right,
alignment locked in place, which prevented the Gasky exercises from really doing what they needed to.
right. So
Yeah,
you got some manual therapy to release that?
that's right. And I'm interested in coming back around and
Yeah, yeah.
up
Well,
again.
great. It would be nice to meet you. So I'm going to answer a question quickly here. No, this is not covered by insurance. Pete Egoscue wouldn't buy into the insurance industry because they have so many restrictions. And so if you go to, just like if you go to a physical therapist, they have to work on the one body part. And so if we went to insurance, they'd assign all these diagnostic codes and say, you can only work on this. And Pete, none of us buy into that. So yeah. And then the person who's just had back surgery, you could start posture therapy after you're done with your physical therapy. And I will be giving a talk on probably a small workshop on low back or back pain, I think in April or May. So no other questions? All right, well, thank you guys very much. It was really a pleasure to see all your faces and to give you the spiel.
Thank you, Grace. This was fabulous. I am going to get my screen back up and share a few things with everyone. I feel so much more aware of how I'm holding my body now. Thank you, Grace, for that.
Thank
You're
you.
welcome. You're welcome.
And as usual, I do have a little list of a few things from the Knowles collection that are related to today's topic. And I did check while Grace was sharing all of her great information with us, and we do have Pete Egoscue's book, Pain Free, in the collection as a print to book and as an e-audiobook that you can stream through Hoopla. And we also have another book by Pete Egoscue, The Egoscue Method of Health Through Motion. That's available as an ebook. And I know
That's
we
also,
have,
sorry, Karina,
no,
that's
go
also
ahead.
a fabulous book because
Okay.
it helps people identify their own posture, and then it gives them instructions on how to do exercises. So I've done a workshop based entirely on that book, and that was the required reading, and it was really fun.
Oh, excellent.
Yeah,
Great. So
sorry.
yeah, those are both in the collection, and I don't have them listed on the slide, but I know we have probably most of what Katie Bowman has published. So most likely we have the books that Grace mentioned there as well. In addition, you can see on your screen several other titles. We have books, e-audio books, even a DVD, and don't worry about trying to frantically scribble these down. I will share these in the email that I will send out within the next week. And each one will be a link that'll take you to that title, right directly to that title in our catalog.
So Karina, I have one more
Yes.
thing to say. The book Pain Free has been updated. So the one that I
Oh,
show is red. The new one is blue and green, I think. And
okay.
I don't know what you have at the library there, but if you were to purchase on Amazon, it would be, the old one is not available as far as I
Okay.
know.
And I'm not sure off the top of my head which one we have either.
Yeah, it doesn't matter there.
But that's good to
Yeah,
know.
yeah.
Excellent. And then what is coming up next for Aging Well? Our next Aging Well program will take place here on Zoom at 11 a.m. on Tuesday, the 21st of May. And we are going to learn about the benefits of mindfulness and how to incorporate a mindfulness practice into your daily life. This will be a workshop that will be led by Mindfulness Northwest, which is a nonprofit organization that was founded in 2011 that just focuses on providing instruction and training for individuals and organizations to help them cultivate mindfulness, which can improve mental and physical health and promote kindness, compassion, and joy. And I think we can all agree you can't have too much of those things. So you can learn more about Mindfulness Northwest by visiting their website, which is, I didn't get on the slide, but it's pretty easy to remember, mindfulnessnorthwest.com. And again, I will send a link to that in the email. And that concludes today's program. Thank you again to Grace for sharing your expansive knowledge with us. And thanks to everyone for your interest in aging well. And of course, thank you to the library's friends organizations across the county who support this program and all our other programs. Take care, everyone, and we will see you again in May.
Thank you.